Blue tongue. The occurrence is worldwide. It's found in warmer regions such as Africa, Australia, and the US and Mediterranean Europe. For the etiology, so the Pseudoreoviridae has the Orbivirus genus, which has the blue tongue virus. It has 29 serotypes. It has 28 for sure, but a 29th one has been recently discovered in China. They have a common surface antigen, which means there's cross-reaction. It's a double-stranded RNA virus and it's non-enveloped. Reoviruses are typically resistant in the environment. However, the Orbivirus is unique as it's sensitive in the environment. It's also an arbovirus, which means it's transmitted by vectors. It has a segmented genome, which is important as it allows for genetic reassortment. They have a double capsid and they can hide their nucleic acid. For the epidemiology, so orboviruses are spread by midges, and in this case, specifically Culicoides. Culicoides imicola is present in the European Union. They are biovectors, but there's no transovarial transmission. It's a Eurixin virus, so it affects sheep mostly, but cattle have a subclinical infection, and goats are very resistant and they maintain the infection. Deer and camels are a reservoir for the disease, and wild ruminants in general. The disease is seasonal. It occurs in the summer and the fall and the autumn, where there's warmer weather. This is good for mosquitoes, or it also occurs where the Culicoides is present year-round. For the pathogenesis of the disease, the midge inoculates the virus into the body, and then the primary replication happens in the lymphatic tissue, and then viremia, which takes 2 weeks, spreads and causes damage to the lymphatic cells, endothelium, and epithelial cells. And it causes transplacental infection, which leads to fetopathy, abortion, hydrocephalus, and cerebral hyperplasia, as well as causing a transplacental infection. This causes fetopathy, abortion, hydrocephalus, and cerebellar hypoplasia. The fetus has immunointolerance, so it doesn't recognize the virus during the time of infection, and as a result, the virus replicates in huge numbers. The virus can also enter the body orally from the mothers eating the placenta. For the clinical signs, sheep are mostly affected. African breeds are also more resistant. In sheep, we can see fever, anorexia, and depression. We can also see endothelium damages such as hemorrhages, mucosa, and reddening, and edema of the head, neck, and tongue. This is because in the case of viremia, the virus binds to red blood cells and causes necrosis of the blood vessels. We can also see epithelial damages in the mucosa and of the feet. In the mucosa, we can see erosions around the nose, mouth, oral cavity, and we can see salivation and decreased weight gain. And a main feature is protruding cyanotic tongue edema. In the feet, it affects the coronary band and causes laminitis and lameness. The disease used to be called the dancing disease because the animals couldn't stand on one foot or the other. They were constantly moving from one foot to the other due to the pain. In the case of fetopathy, it causes abortion, joint development problems, and hydrocephalus. And we can also see a loss of wool within the sheep. In cattle, it's frequently a subclinical infection, and the cattle can keep the virus around in the winter months when the mosquitoes leave. For their clinical signs, they can experience reddening of the conjunctiva and nasal mucosa, and they have serous nasal discharge, and they can have abortion and fetopathy, and edema of the lip and eyelids. Cattle have a longer viremia because the disease is milder. And in goats, the disease is subclinical. So to summarize, in cattle, goats, and camels, the disease is mostly asymptomatic. However, in sheep and South American camelids, such as llamas, the disease is severe. In the pathology, we can see vessel damages. Hemorrhages are seen in the lungs, kidney, and heart. And edema is seen in the head, neck, and we can also see cyanosis. In the histopathology, we can see necrosis and degeneration and thrombosis and inflammation, as well as hydrothorax, hydropericardium, and ascites, so we can see a lot of fluid loss. And the main one we see is hemorrhagic gastroenteritis of lambs. For the diagnosis, it's a notifiable disease. It has a lot of similarity to foot and mouth disease. To diagnose, we look at the epidemiology, the clinical signs, and the post-mortem lesions. To detect the virus directly, we do a real-time PCR. It's the best and quickest way. We can also do isolation and IF and immunohistochemistry. To detect the virus indirectly, we do ELISA. So real-time PCR and ELISA are the main ones we do. Viral neutralization is too long, but it can help reveal the serotype. The differential diagnosis can be foot-and-mouth disease and sheeppox. For prevention, in free countries, you need to prevent the introduction, so have no imports from endemic regions and have mosquito control. It's also important to factor in that asymptomatic newborn calves can carry the virus in the wintertime. In the case of an outbreak, you need to have movement restrictions, so have a restriction zone at 20 kilometers, protection zone at 100 kilometers, and a surveillance zone at 150 kilometers. Stamping out the virus is also required. There is an authorized inactivated vaccine in the cases of emergency. In endemic areas like Africa, there is mass vaccination. There is a polyvalent attenuated vaccine. It's polyvalent due to the serotype species protection. However, there is a risk of reversion and mosquitoes spreading the attenuated vaccine.